The U.S. healthcare system faced significant turmoil in February 2024 when Change Healthcare, a major healthcare technology company responsible for processing nearly half of all medical claims, suffered a major cyber attack. The Black Cat ransomware group gained access to CHC's network by using stolen credentials to log into the company's Citrix remote access service. The attack disrupted key operations, including claims processing and electronic bill pay services. Up to 6 terabytes of data was stolen, including PII, payment details, and insurance records. This timeline highlights the significant delay between the initial attack and the public disclosure of its full impact, as well as the critical role that security failures played in enabling the breach. Let's examine how the incident unfolded. First, attackers obtained user credentials that were either weak or exposed on the dark web. And since MFA was not in place, the attackers were able to log into the portal without any additional verification, such as a one-time code or biometric scan. After gaining initial access, the attackers escalated their privileges on the domain by creating a new admin account, likely through brute force attacks or exploiting vulnerabilities in the Active Directory configuration. This broader access enabled them to set up several new user accounts. And to maintain persistent access, they likely established a command and control channel via HTTPS or installed remote access software, allowing ongoing control, command execution, and remote manipulation of compromised systems. The attackers downloaded the ransomware from a cloud file share. With admin privileges and user accounts established and a backup connection in place, they initiated lateral movement within the network. The attackers spent 9 days exploring and identifying key servers and data within the network. And after this reconnaissance phase, they exfiltrated 6 terabytes of data before installing ransomware on the targeted systems. The attackers were not detected because they leveraged weak detection mechanisms, poor monitoring, and a lack of robust security measures like MFA and network segmentation. These gaps allowed their actions to blend into legitimate traffic and proceed undetected for an extended period. CHC suffered from critical security failures in account management, lacking MFA and robust password policies. Data security was compromised by inadequate access controls and insufficient encryption of sensitive data both in transit and at rest. System security was deficient due to a lack of network segmentation, enabling again lateral movement by the attackers, and vulnerable remote access tools compounded the issue. Outdated or unpatched software like the Citrix remote access service was exploited by the attackers. Weak code integrity in their custom applications or APIs could have allowed for injection attacks or unauthorized data access. Reliance on insecure third-party software, such as the ConnectWise Screen Connect application, could have provided another entry point for attackers. Privacy security failures were evident in the unauthorized access to sensitive patient data and insurance records. To enhance account security, it is recommended to implement MFA for all systems and applications. Enforce strong password policies, adopt password managers, implement account lockout mechanisms, and conduct regular credential audits. For data security, encrypt data at rest using encryption algorithms like AES 256, encrypt data in transit by enforcing TLS 1.3 for all communication protocols, disable outdated protocols such as SSL, TLS 1.0, and TLS 1.1, and secure APIs with OAuth 2.0. Other recommendations include using data masking and anonymization, monitoring for suspicious data activity to detect and respond to unauthorized data access or exfiltration attempts, and isolating data segments with network segmentation to reduce the risk of lateral movement, again by attackers. For system security, again, implementing network segmentation such as isolating sensitive data and creating VLANs or microsegmentation for health systems, and deploying intrusion detection prevention systems to monitor network traffic for anomalies, and harden systems and applications by adhering to NIST standards and implementing strict firewall rules to block unauthorized access. A recommendation is to fully implement a zero trust security model. And whenever possible, legacy systems should be replaced. For security of software, strengthen API security and conduct regular penetration tests to identify vulnerabilities, and prioritize secure coding practices to prevent injection attacks such as SQL injections and cross-site scripting. And for privacy, developing a more robust incident response plan and regular security awareness training, and improve breach notification policies and transparency. As of this date, some CHC systems have not yet been fully restored. Change Healthcare's Cyberattack exemplifies how a single point of failure, like an exposed Citrix server without MFA, can lead to a significant ransomware attack and data breach.